The first of this month, more than 2 years after the discovery of the first cases of COVID-19, Denmark became the first country in the European Union to lift all COVID restrictions. Gone are the indoor mask mandates. Gone are the isolation requirements for the infected. If 2 years of fear, uncertainty, and loss had crushed Danes' spirits, it was not apparent the first weekend the restrictions were lifted, when they flocked to nightclubs. This might seem alarming, but the truth is that the country's response to the pandemic thus far has been in many ways exemplary. In 2020, when the world knew little about the virus and how it spread, Denmark was one of the first countries in Europe to lock down. But as the New York Times notes, since then, the country has adopted a very flexible approach to COVID restrictions that the public has by and large supported. There were no draconian curfews. Guidance to socially distance and mask was generally followed, in part because it was often re-evaluated. Officials, including the Prime Minister, held regular televised press conferences about the pandemic, and there was little talk of a vaccine mandate, nor did there have to be. 81% of Danes are fully vaccinated. That compares to just 64% of Americans. So how did Denmark do it? The key may lie in the fact that the country has long had high levels of trust in the government, and citizens have high levels of trust in one another. According to a new study in The Lancet that compares caseloads in 177 countries and territories from January 2020 to September of last year, those are the two most significant factors that are associated with low numbers of infections of COVID-19. This is an important finding. Siddhartha Mukherjee once called COVID an epidemiological mystery because it confounds conventional wisdom about which countries should fare better in a pandemic, namely rich ones. According to the New Lancet study, the rankings of the famous or infamous Johns Hopkins Global Health Security Index for the countries that were theoretically best prepared for a pandemic had no correlation with either the COVID case counts or the proportion of those infections that led to deaths. The authors looked at a dizzying array of metrics to find out what did. They looked at population level factors, age, body mass index, smoking habits. They looked at environmental factors, air pollution, altitude, even the number of bat species living in each location. They looked at structural factors, democracy, populism, levels of economic inequality. Age had the most significant link to fatality rates among countries, of course, but according to the study, the two factors that had the most statistically significant link to case numbers were citizens' trust in the government and trust in each other. Not inequality, not democracy, not even the effectiveness of the government or how much it spent on health. So the US, with historically low levels of government trust and a high degree of political polarization, had 545 cases per 1,000 citizens. Canada, which fares better in terms of trust, had just 346. Denmark, where one estimate shows 90% of the population trusts its government, had just 166. But it's not just rich countries that demonstrate this trend. As the Washington Post reports, Vietnam has a closed single-party political system and few hospital beds for its population, but it has a high degree of trust in the government. And it had 67 cases per 1,000 individuals, just 67, from January 2020 to September of last year. The study found that if every country had the level of trust that Danes do in their government, the global caseload might have been nearly 13% lower. If every global citizen had as much trust in his countrymen as the South Koreans, we might have had 40% fewer cases. Combined, that would have meant 440 million fewer coronavirus cases, according to Tom Boyke, one of the paper's authors. We all bemoan the lack of trust in the United States these days, but this shows how, in an emergency, a lack of trust and social capital can actually cost lives, hundreds of thousands of lives. Thanks to all of you for being part of my program this week. I will see you next week.